Welcome everybody to the home dialysis webinar, hosted today by Kidney Wales. We are so pleased to have you join us today as we explore the options, the practicalities, and the experiences of home dialysis. So this session is designed to provide some valuable insights to help you make a more informed decision about your dialysis care. And we'll cover a range of topics, including home dialysis, like options and setup, the training and support that is available, the utility needs and the financial assistance. And then at the end, we'll be joined by James, who will be sharing his patient experience as well. Now, our aims for this webinar is to provide you with the knowledge and insight to support you in your decision making, to answer any questions you may have about home dialysis, and to address any areas of concern that you may have. And to start off with, I'm delighted to introduce you to our first group of guest speakers, which is Sarah, Zara, and Julie. Ooh. So without further ado, guys, I'll hand over to you.
I'll introduce myself. My name's Sarah Hurst-Williams. I work with the home dialysis team in Ysbyty Gwynedd in North Wales.
And my name's Sarah Baker, and I work with Sarah and Julie with the home dialysis team in North Wales in Bangor.
Hi, I'm Julie, and I work with the home therapies team in Ysbyty Gwynedd, Bangor as well.
Our aim today is to just hopefully give you a brief overview of the services we provide. There may well be local variances across Wales, so I apologise if there's anything that maybe doesn't quite fit with how it might work with other hospitals. But what I'll do is make a start in the telling you sort of from a decision-making part how we actually start the journey. So it all starts with our kidney care team, and maybe known as your CKD team in your areas, which we work very closely with. And as a patient is coming towards making decisions, we do a home visit as a home dialysis team with the kidney care team to talk to the patients about options and what may suit them and their lifestyle and their needs and wants. And the reason we do a joint visit is because the kidney care team already are familiar with the patients, and we feel that it gives that familiarity and an introduction to our team, so that then we can then take decision making forward, depending on whether that is for a home dialysis based dialysis, or whether they then decide maybe they want to have dialysis in centre, which is obviously that their choice. Once a decision for the dialysis is made, during the visit we assess the home suitability for home hemodialysis as well as peritoneal dialysis, because even though a patient might choose peritoneal dialysis, that decision may not be able to be supported following medical review or whatever, and we know then that we've already reviewed the house for supporting another form of home dialysis, which is why we like to take that sort of holistic approach at seeing someone's home. I'm going to focus on hemodialysis mainly, and to tell you how that works once that decision has been made to go for home hemodialysis. Julie will talk further about peritoneal dialysis once we get to the next slide. It's important to sort of have the early conversations before the need for dialysis has actually come around, so that hopefully whatever that decision making is, we can support it right from the start. So once the patient has decided they want home dialysis, we'll obviously check that they've got enough storage in their home and that we can access drainage and electricity quite easily. And if that's not accessible, we do have another option, which Sarah will discuss a bit further down the line in a minute. So once a patient has decided that they want to do home dialysis, we are very lucky to have a self-care area in Ysbyty Gwynedd, which supports 3 people in the morning and 3 people in the afternoon. We try and introduce the person choosing to do home dialysis straight into the self-care area rather than start dialysis in the main in-centre dialysis area. We try and promote self-care right from day one. And I don't mean self-care as in expecting anyone to do anything or any great tasks like lining dialysis machines or having to look at those needles that look really scary when people first see them, but to hopefully drip feed the training. So maybe starting with taking tablets home and learning how to take those when maybe a unit might have given them out, or learning how to do EPO injections or neorecombinant injections, which some people might already be giving, but if they're not, we would help you learn how to do that. So how our self-care area works is we dialyse 4 days a week on a Monday, Tuesday, Thursday, Friday. We do shortened sessions to enable lots of training time. And our training time very much welcomes family members coming in, children coming to have a look at machines so that they understand what might be coming into the home, but not if the patient doesn't want that either, and very much patient driven. So our main ethos is the patients are the boss, we teach them a safe way to do it. So very much directed by the patients and how they would like to take it forward. And also, there are no timelines driven when we're training patients in self-care. If in the first week, 2 weeks, you want to learn to line a dialysis machine and get a handle on the needles, that's fine. But if you don't, and it takes 2 or 3 months to do that, that's absolutely fine too. And again, very much patient driven. So I don't know, Sarah, do you want to come in on the differences, or do you want me to continue with the home dialysis side of things?
You continue if you like.
Then
you can continue with that bit if you like.
So once a patient has achieved a certain amount of competencies, so those competencies being learning how to use the dialysis machine, learning how to hand wash properly, learning how to deal with your own access, whether it be a central venous catheter or a fistula. We then make a plan for taking the patient home, and the plan is very much made again alongside the patient and their families. It's very much driven by them, but also we have to order all the equipment in and do a bit of work in the home. And that the machines can take 6 weeks once they're ordered. So we do have plenty of time to initiate treatment and plan for home. But during the training in self-care, we teach a patient to learn how to do a daily home dialysis or overnight hemodialysis, so the patient has the options of learning how to do both, and that when they do go home, they've then got the autonomy to decide which dialysis suits them and which one works for best for their lifestyle, with very minimal training afterwards, because they'll have done most of that training while they were in self-care. Yeah, and then I'll let Sarah go into the differences between, once we get home, what our support is, and then go into the differences of daily home dialysis and nocturnal dialysis.
Nice. So there we are. The patient's ready then to go home. We're the same team of staff that will have supported the patients in self-care that take the patients home. The patients are nominated normally one nurse that takes over the majority of their care, but they've got to know all of us whilst they're training in self-care, and do see the whole team popping in and out of their home when more support's needed, or when they're coming in for iron infusions or anything else that they might need while they're at home. So they get home. We support them that first week. Again, patient driven. Some patients want us there for a couple of days. Some patients want us there for over a week. And then we gently back off when they're feeling confident. And we've gone through competencies and knowing that they're safe at home to dialyse without anybody there or with a carer there with them. They then will see us monthly unless they need more support, again driven by the patients. They let us know if they need support, if they having some needling issues, any problems that they're having, and then we see them monthly. Now is a good time to talk about the two different machines. So again, a regional variation, we have two machines. One's a B-Braun Dialogue and the other the Fasidia that you can see in the picture here with one of our much loved patients. So the B-Braun machine is the one that we aim for if we've got good water supply and a good area to fit the machine. It does need wall filters. It does need a good electricity supply that we provide as well through another external company come in and fit it all for you. That machine can dialyse anything that you want it to dialyse, and this is the machine that we use for nocturnal dialysis. The smaller machine in the picture is the Facidia machine. That's more transportable. It's still heavy, but you can move it. That comes with a lot of stock, using 7 5-litre bags every session, and it can only do up to 3 hours, so not suitable at all for nocturnal. So there's pluses and minuses for both machines, but both do the same job. Then once the patient's at home and they're settled, along with the monthly visits, we offer an on-call service, and the on-call service is 24 hours a day, 7 days a week. So we're contactable. One of us is contactable with any issues that patients have, and they're very patient with us in the night if they do phone, because we maybe need a couple of seconds just to wake them properly before we're posed with an issue going on. But that support's there, obviously, for all the time for the patients once they're home. Once they're home as well, we encourage as much of a normal life as you can. So we encourage holidays, or like Sarah said, it's about the patient driving the treatment and us finding a safe way of doing it. So if we don't encourage weekends off as a routine, but because the more dialysis, well, we don't want them to have the big breaks because it's not good for your bloods. But if we can help support a weekend off for a nice trip or something, of course, we find a safe way of doing it. And I think that brings me to the end of the hemo. Does it, Sarah?
No, well, I could come in here a bit more, actually, just to talk a bit more about we work well as a team here. We bounce off each other, don't we, Sarah? So yeah, we are, like I said before, we do offer daily home hemodialysis or nocturnal hemodialysis, but we like the patients to learn both. It's very important to say we're not dependent on anyone having any carers. We like people to be autonomous in their own care, but if they like to work at it as a team with their spouses too, that's fine too. We welcome absolutely everything. Nothing is not doable as far as we're concerned. So we put things in place to make people safe. So no matter, if you're very independent and you want to dialyse on your own, that's absolutely fine. We put things in place to make sure you're safe. And that all happens during the training period. Silly things like maybe you might think it's silly, but just making sure you've got phone contact, making sure you've got a key safe outside so people can get in easily, teaching you how to deal with things like electricity going off or the water suddenly turning off. We teach all of that, what to do in an emergency like a fire in the house. All of that is covered during the training period, just to reassure you, because these questions pop up and you think, how would I ever deal with that? But it's something as part of the training package. So as I said, it can be carried out alone or with family members or a friend, where we very much advocate the more dialysis you do, the better you do, because if you think about it, kidneys work 24 hours a day, and actually to have dialysis in centre is quite minimal, 4 hours 3 times a week, and that is very much the minimal recommendation of 12 hours per week. Once the patients go home with us, we do recommend at least 15 hours a week, those 15 hours being divided up between a very minimum of 5 days, but we welcome 7 days of 2-3 hours. The more you do, the better you are. But then also for you to learn the nocturnal hemodialysis side of things. Now that works a lot slower. It's a lot more gentler on the body. It's got outcomes on a par with having transplantation, in that you need very minimal medication. Your diet can be freed up. You can, you basically turn the dialysis dietary advice in centre on its head when you do nocturnal dialysis. Obviously that's working in conjunction with your dietitians and pharmacists, and with your bloods being monitored very closely. So again, regional variations, but we very much advocate nocturnal hemodialysis. It enables people to work, attend to their childcare, but it's not an easy feat in that you need to be able to sleep on the dialysis machine. It can be like lying next to a new baby and that you sort of sleep with one eye open for a while. And then after a few weeks, you do start to relax into it and start to feel really great. And, you know, we've seen some wonderful examples of patients feeling quite poorly when they first go home to really living their best life and enjoying themselves. So yeah, the more dialysis, the better is the message we'd like to take forward with that. I'm ready to move. Ready to move on to the next slide, if that's okay.
Hi, can you hear me all? I've just pressed a button. I'm just making sure you can hear me.
Yeah, we can hear you.
Brilliant. Okay, so my name's Julie and I get to talk about peritoneal dialysis. So this is the dialysis, which is a very gentle, and it uses fluid going into your abdomen via a catheter or a tube. And there are two different types. There's what we call CAPD, which is continuous ambulatory peritoneal dialysis. And that's the one that you've probably heard about, where it's 4 bags a day. So you'll do what we call exchanges in the morning, dinner, tea time at night. Or there's the automated peritoneal dialysis, which is a machine which does the same, but at night. Again, you just you connect yourself, you disconnect yourself in the morning, and the machine basically does everything for you, which is the one that most patients prefer to go on because it's minimal disruption to the daily life. You'll see the other option I've got is for assisted automated peritoneal dialysis. Now, this isn't available everywhere. We are very fortunate in Bangor, Ysbyty Gwynedd, that we do have this available option. And it's where a team would come in and assist you to do automated peritoneal dialysis. So these are for patients who might have very, very limited dexterity. They might not be able to carry the bags or carry bags up and down stairs or manage their stock, but they'll get a technician to go in and do the setting up. And it might be that the patient can connect themselves and disconnect themselves. The great advantage is we keep a lot more patients at home that we might not have been able to because of various issues that might have ruled them out. So the 4 bags a day, we like to start our patients off on this. We like to know what goes in does come out. It's really good practice for patients to be able to do this in the event of a power cut or electricity disruption, and it's a really good backup. Most patients start on this with the aim of going onto the machine at night. Now, the machine at night, I think we've got 14 patients on at the moment, and between the lot of them, not one of them has got the same regime. They've all got a different regime. So it might take us a few weeks to perfect what regime is going to work for them. But we do get there. And like Sarah said earlier on, it's like taking a baby home, a new baby. There's a few alarms, but we get through it and we get them settled. We get the patient settled. Our peritoneal dialysis patients benefit from exactly the same as what the home hemo ones do. They have monthly visits. They have a 24-hour on-call available to them. They have monthly bloods, regular checkups, regular clinics. They get taught exactly the same techniques as the home hemo ones. The great thing about our team is because we're a combined team, and we've had it where their peritoneal dialysis has started to fail. Because we've looked after them for so long, we are able to transition them straight into home hemodialysis. Now, the great thing about peritoneal dialysis and home hemodialysis is the basic techniques are still the same. The hand washing techniques, the non-touch techniques about not touching the ends of anything. And because they know our team, the transition is a lot easier. The benefit with the peritoneal dialysis is it's very, very portable. Oh, sorry, something happened then. Sorry, yes, it's very, very portable. So again, you can pick up and go anywhere you want to. Holidays, we actively encourage holidays, but we do need notice. I've got to be very honest about that. You know, for like the Canary Islands, you would need 8 weeks notice to get the stock there. So there's a lot of planning involved. There's no just lastminute.com. And you can literally go wherever you want to. However, again, a few restrictions. Now, as a team, we work very hard with the kidney care team in getting to know the patients and being part of their decision-making process and understanding what the patients want and what's going to work best for them. And we have a couple of ways of getting catheters, PD catheters in. So we what we call either do a cut and cover or a cut and go. So with a cut and cover, this is long-term planning where we would put a catheter in quite a few months or maybe years beforehand with the view that as soon as the EGFR has gone down or the patient is symptomatic, we as a team retrieve the catheter and are able to commence PD or peritoneal dialysis in a nice, planned, organised manner. The same with a cut and go. So this time we leave the catheter exposed, again with the plan that the patient can start when they need to. So we work very closely with the surgical team to put in these and the clinicians, and basically getting the patient to understand exactly what they want. Most patients like to have a cut and cover, to be fair. They like to know that the catheter's there, ready for when the time comes to start. And we absolutely work with that. But on the other hand, if the patient says, oh, no, I'd like to leave it out and I know it's there ready, then one less thing to do, we can just crack on and get going. So we very much work alongside the patient, but again, patient is boss with the clinicians and with the kidney care team. Quite often with the kidney care team as well, if a patient's not ready to start peritoneal dialysis, we hand the care back to them and then they come back to us when they're ready to start the dialysis. It's all very planned, and the patient's a boss at the end of the day. We go through competencies. Well, we say competencies, but it's very important to us that the patient understands their treatments, their disease, what they're having, why they need to have it. So with the APD, with the machine, they would do it every night. With the CAPD, they would do 4 exchanges a day, which can be quite burdensome, which is why we like to get them onto and they like to get onto the machine at night. But if they understand what they're doing, then they're more likely to do the treatment. So, and we very much want them to understand their medications, their diet, their disease, their fluids that they're putting in them and what's coming out, how to manage any complications, any signs of infections to alert the team very early on and not leave it until they're quite poorly. So we very much work alongside the patients. They know that we're there for them. Basically, that's it from me. Hand over to the next presenter.
I think we've got one more slide actually, Julie.
Yeah. It's just, what concerns do patients have?
Yeah, I can.
I'd forgotten about that one.
Oh, it's okay. Well, this is our mantra and this is our favorite picture. We love all the patients seeing this.
Yes,
and it's understanding that we don't set the bar high. It's baby steps all the way. And some people like to run and fly, and other people just like to take the time, and that's absolutely fine too. And we advocate whatever suits the patient and their family. As far as we're concerned, that's the priority. Can I do this? Absolutely. Anyone can do a form of home dialysis. It's about overcoming the barriers and what those barriers are. I think our next speaker will talk about some of those barriers and what we can do to break down the barriers from a housing perspective and financial perspective and things like that, because all of that can be really concerning for a patient. How long it will take, certainly from our perspective, it's as long as it needs to take until you feel safe doing it and you feel reassured that you've got the support and that you're confident in what you do. Who will help me? So you've got your named nurses, but you've got a massive MDT around you, which are dietitians, pharmacists, social workers, nursing staff, clinical staff, but also we put in a lot of support around risk assessment. So, particularly around the patient's individual needs, we look at things, we risk assess them, we put mitigation in place so that the family and patients feel really reassured that we put things in place to make them feel safe. Absolutely, anyone can do dialysis at home to that extent, certainly from living alone to needing some help from a carer. There are some incidences that we as a team have struggled to find support, certainly from a social support side of things, so that if someone maybe suffers with epilepsy and has no warning of those fits coming on, we as a team have actually struggled and would welcome any other teams that have managed to get over that barrier to get some support for those patients at home to make sure they can dialyse at home safely. But we can pretty much, Julie, pardon me if I'm wrong here, overcome most barriers to make sure home can happen, whether that be PD or home hemodialysis.
We're pretty dynamic as a team in overcoming any barriers, anything you throw in front of us, we'll have a go challenge. And we basically, there's not much that beats us as a team, because as a team we're very diverse. And one of us will always have the solution somewhere, or we'll know somebody who will have the solution. So yeah, nothing much beats us. And it all starts with those subtle assessments, those first meetings with the patient in their own home, and understanding what you need to overcome. Even down to watching a patient go upstairs. Can they walk up and downstairs quite normally, or are they crawling on all fours? So, and then that's where your basic, okay, well, we might have a bit of an issue here, but we can overcome it. Space, we can overcome space. We always find a solution.
I think if I could come in here, Julie, as well, from a space perspective, it's being realistic in what as health boards we can provide and do for people, and it's about maybe being a bit inventive, that shoving a few boxes under a bed and in a wardrobe and just making space wherever possible to make it happen. It's about how much you want it to happen, but also working with us as a team to what we can put in place to make things better for you, because where we can we will, but it has to be a joint effort. But also managing emergencies. I covered it slightly before, in that we have key safes for if someone needs to get in, if someone has a blood pressure that just drops a little bit and they feel a bit not okay, learning how to manage that. All of that is done during the training process and covered during that training process. But certainly as our team, and again, this is a national variance, we use Skype as a form of contact with the patients. So all our patients have access to Skype, certainly from a home hemodialysis perspective, and from a PD perspective. During COVID, all the patients were registered on Skype. We have a slight problem to overcome ourselves soon, in that Skype is being discontinued in May. All the patients sign a consent form to agree to use Skype, knowing that other people might hear that conversation, but that conversation isn't a personal conversation. It's literally about how to manage technically the machines. But actually, we have found a way to get around that. Having that visual way of sorting patients out at home, rather than over a phone trying to work out where that button that screws into that thingy button. When you're doing that over the phone, it's quite difficult, but when you've got visual, that's really easy. So we try and overcome everything that is an issue and might be perceived as an issue. Thank you for listening. I hope that covers everything everybody needs to know.
Well, first of all, I just wanted to say a massive thank you to the three of you there. And before we move on to hear from our Kidney Wales patient support manager, Kareen, who will be sharing a bit more about the financial assistance. I just want to open the floor for any questions off the bat at the moment. So if anybody does have any questions, if you'd like to raise your hand in the chat or use the chat box function, we can open that up then for you to ask away. I did have one question for you both, but I don't know who's going to be best to answer this. But from the perspective of someone who may not be on dialysis yet, but they know early enough to make to start planning and making their decisions, how easy would that be for them if they wanted to go onto home dialysis before having started dialysis to begin with? And what would that process look like? Would it look any different for someone who hasn't been on dialysis before?
So shall I answer this one? So the discussion would be made pre-dialysis, so they wouldn't need to ever had dialysis before, and if home hemo was seen as suitable or most probably suitable, then we would bring those patients straight into self-care and start training straight away with us. So they wouldn't need to be on hemo before coming to have dialysis with us in self-care, or even having a look round for the first, session and discussing it. And then when the need for dialysis is there, then they come straight to us.
Lovely. So they wouldn't need to sort of do it in the unit for a period of time before they can move to home dialysis. They can make that decision quite early on.
Yeah, and then we're happy to have them straight in with us training, which works out very well.
We very much advocate coming straight into self-care, because you can get quickly used to having nursing care when something's scary, and being dependent on that nursing care, and then becoming nervous of being able to do it yourself. Whereas if you've had a go right from the beginning, you know then what you're capable of and what you can do. And there is no contract. There's no, if you come into self-care, you've got to go home. Even if you come into self-care and learn a fair element of self-care and then decide it's not for you, that's absolutely fine too. But it means then you're attending to some parts of your own care. I mean, best case scenario is obviously everybody goes home, but it's not a failure if you don't. It just means that you've had a go and that you've learned to attend to some aspects of care, which is really great.
That's amazing. I've just had a little look in the chat and I can't see that any questions have come up, but I've got to say that was a very upbeat. One person's raised their hand. Sorry, I'm just gonna. Abby, did you have a question that you wanted to ask then?
Yes, my partner is currently on emergency hemodialysis, but he's due to go on to peritoneal in the next few months. We were just wondering if there was any help that we can get in terms of housing, because we're currently in a 1-bedroom, 2nd-story flat.
Whereabouts are you residing, Abby?
We're in Bather, so the Pontypridd area. So his hospital is Heath.
So we have been involved heavily with a housing project up in North Wales recently as regards helping people and making kidney failure seen as a priority and an urgent need for housing when it can sustain a home therapy. And there is a big drive to try and encourage that pathway in the southern areas of Wales at the minute, because housing stock is at a premium. I believe in South Wales there's a real crisis going on at the minute. It's quite a difficult feat to have. But have you actually spoken to your social workers within your area to say that you need help?
Yeah, we have. We've one of the social workers said that she was going to write a letter for us to provide to our housing agency.
Yeah.
And the doctor has also said he's going to write us a letter again, because we've given letters previously to the housing agency, but they don't see it as a priority because he's not actually on peritoneal dialysis yet. Whereas we were very much coming from the aspect of we would like to move now in preparation for it.
I think that's where you're going to have the difficulty. In our experience, you need to have demonstrated that that is the dialysis modality of choice, and that is where you're at, and that the tube would be inserted, and that then potentially the housing would be considered, and that would be the same in North Wales. And because it's such a premium in South Wales, you've obviously got more of a difficulty there. And it's great that you're wanting to be proactive with that. And I suggest you keep on with that. And if you keep facing advocacy, get in touch with your local councillors and try and get them to back you, because we want parity across Wales, and that, you know, kidney failure should be seen in parity with other life-limiting diseases or life, it is going to affect life long term for you potentially if you can't have, you know, the dialysis choice you would like. And that if you can get that need out there to your local councillors, you'll actually be doing a lot of people a favour, because we are struggling to get the a message out there to say, you know, it should be seen in parity with other people with lifelong concerns.
Yeah, no, that's definitely going to be my next step if I keep facing trouble with housing.
Yeah,
So
don't stop.
you.
Don't stop. Just keep shouting. You'll get there eventually.
That's great. Thank you very much.
Thank you so much for asking that question, Abby. Before I move forward, did anybody else have any questions that they would like to ask the team? Lovely. In which case, I will hand over to Karine, who is Kidney Wales Patient Support Manager, and she's going to be talking to you about the costs and financial assistance.
Thank you for having us. Bye-bye.
Cheers. Thank you.
Hi, everyone. So as previously mentioned, along your kind of decision-making journey to home dialysis, the NHS will complete a home assessment, which will consider some of the logistics that go behind having home dialysis, obviously at home. They'll work with you to discuss the best room and how dialysis can work at home for you, which will include things like storage, as mentioned, for the delivery of your stock. Kidney Wales have previously, funded storage options like sheds and lockers that are fitted in the garden to help with this kind of thing as well. So I'll go into that in a little bit in just a moment. So the NHS cover any costs of, will cover the cost of any installations of the machine and any alterations that need to be done in the home, such as, where the pipes and the water supply connects to. Home hemodialysis machines use electricity and water, and peritoneal dialysis uses electricity to heat the bags or to run the overnight machine. The additional electricity and water used for your dialysis will naturally increase the cost of your utility bills, which is where the reimbursement scheme comes in as a repayment for the additional costs relating to your dialysis. So with regards to the water is the most expensive part of the reimbursement, as it's used during your treatment and also keeping the machine safe, so your cleaning process. If you are on a water meter, you need to let your renal team know so that they can support you in making sure that you get a water cap in place for you, which is a bill cap with Water Sure Wales tariff. I think most are probably with Dŵr Cymru Welsh Water, but the same water rates apply in Wales. Your annual metered bill amount, they'll cap it at a certain level, so you won't pay over a certain amount for the year, no matter what your actual consumption is. And home dialysis is one of the criteria of eligibility for this, as the water usage obviously is a lot more due to your medical equipment at home. With regards to the electricity, an annual review of the main energy providers is undertaken on an all Wales basis, so no matter where you are in Wales. The Welsh Kidney Network monitor this. It gives an average cost per hour from your machine, which is what is used for the purpose of the reimbursement. So your home dialysis team will explain the process on how the home dialysis utility reimbursement payments will be made to you. You'll be asked to provide things like your bank account details so that the payments can be made directly to you. A dialysis prescription is created by your team in relation to the reimbursement of your utility costs. So what that basically means is it will be based on the frequency, so how many times per week you're dialysing, the duration, how long you're on the machine for, and any cleaning cycles are included as well. So any of those that are needed per week for the dialysis equipment, and that's all taken into account to create that average cost of what the extra use of electricity will be. It's really important just to keep that communication open with your renal team and just inform them of any changes to your dialysis that might affect that utility reimbursement so that it can be adjusted or communicated and documented for you. And it's also worth noting that Nest, which is a government-funded scheme which is still running at the moment, can also offer free sort of impartial advice. And if eligible, a package of efficiency improvements can be made for you in your home. So things like just to help lower the cost of your energy bills, whether that be a new boiler or central heating or insulation for your property, which we can, as a charity, we can refer you into. You should also consider maybe applying for personal independence payments or PIP. PIPs, it's a non-means tested benefit to people just to help with the extra costs of long-term illness or disability. It's a non-means tested benefit, so it can be paid regardless of income. There's a lower and higher rate, and it doesn't matter how much savings you have, or it's not based on your national insurance contributions either. And it's just another way to access the water sewer scheme as well, which is the bill cap as mentioned just now, just to help with those costs there. Priority registers. A household with medical equipment should be registered with the energy supplier as a priority service user. And this just ensures that support is provided should your supply be disrupted in any way, and also any additional support, if needed, offered if you're struggling to meet the cost of the energy needs as well. Most suppliers have online forms that you can complete to register. Some need proof. They work in different ways slightly, but if you need obviously any help in signposting towards your energy suppliers page or where to apply, I can certainly help you with that. Same goes for your council tax. You might be entitled to a council tax reduction depending on your circumstances as well. As a single person occupant, if you're living alone, you should be getting a 25% reduction anyway. But if your property has been adapted for a disabled person, so such as, for example, an additional bathroom or a kitchen to meet the needs of that disabled person, or if an adaptation has been made on an existing room to meet the needs of and sort of mainly used by that disabled person, or if extra space inside the property has been made for the use of a wheelchair perhaps, then you may also be entitled to a reduction. But that's you would need to inquire and apply through your local council. And I know renal social workers are great at making sure that you're applying for all the right benefits and pointing you in the right directions for those as well. And lastly then, for me, our Kidney Wales grants. All the charities, Kidney Care UK, Kidney Wales and POP, offer grants to patients that can help towards extra costs. Our grants, up to the value of £500, they can be used towards things like utility or rent arrears, white goods such as cookers or washing machines, mattresses, or any equipment or items for your home that might make things a little bit easier. And as mentioned earlier, they can also be used to buy a shed or storage for your dialysis supplies. So if you are limited on space and you've got a garden, we can certainly look into looking at storage options there for you, just to give you that extra bit of space within your property if it'll allow. All you need to do is ask your renal social worker to apply. They're all pretty familiar with completing our application, so they'll know what you mean. And there's also, obviously, as I've mentioned, other grants available from other local charities such as Kidney Care UK and POP that we can combine with as well. If something costs a little bit more than that £500, for example, we can certainly pair up with Kidney Care UK and with their grants as well and bump it up a little bit more if needed. And again, if you've got any questions or you're not sure on who your renal social worker is, for example, just get in touch. I'll be happy to help point in the right direction. All the information that I've mentioned in this little slide, obviously it's been a lot. There's a lot to do with financial and reimbursement there. It's all will be available in the PDF that'll be after this. But obviously, as I've said, if you've got any questions, just reach out and I'll be happy to signpost or help. That's it.
That's great. Thank you, Corrine, for the information on financial assistance. Before we move on to hear from James, our volunteer ambassador, who will be sharing a bit about his personal experience with home dialysis, I just want to take a moment to see if anybody had any questions at the moment for Corrine. If you do, similar again, if you just pop a question in the chat box or raise your hand and I can allow for you to speak in the chat. But just quickly, I know previously they spoke about also having friends and family involved and potentially them helping you with your care at home. So, Kareem, would you be able to tell them a little bit about our carers vouchers for anybody who may be assisting?
Yeah, certainly if you're a carer of a kidney patient, or if you're a kidney patient looking after somebody else, our carers vouchers are up to the value of £150, and they can go towards things like a voucher for a meals out, days out, family days out for trips, cinema tickets, theatre tickets, things, just something as a little bit of a respite or a treat for the carers. If you've got a partner that's helping you assist at home with dialysis, it might be a nice little treat for them, or a parent, or anything really that you can apply. And they apply in the same way as our grants through the renal social workers, who again, obviously very familiar with our forms that can help you with that.
Lovely, thank you. I can't see any hands raised or any questions in the chat box, so I will pass over to James.
Thanks, Georgia. Hi, everyone. I'm James. I'm a home hemodialysis patient. I've been on nocturnal hemodialysis since September, October last year, so I'm quite new, but getting settled into it. I previously did 5 years of hemodialysis in unit at Marston Hospital in the Liz Baker dialysis unit. I wanted to do home dialysis beforehand, but unfortunately my housing situation wouldn't allow me. I had a landlord that wasn't the most cooperative, so I managed to move eventually, and I've been set up with home dialysis since September, October. The pictures you can see on your screen now is the storage. So you can see there's quite a lot of stuff that you need to store. So I thought it was useful for everybody to see. You can also see the machine that we use down here in Morriston. It's a Fresenius machine. So it's a big lump of a machine, but it's very good. There's also a picture of the plumbing that you can see there. Just to show you how much is involved. So for this machine, we need separate water, electrical, and some filtration. So that's all, you can see all of that there as well. I think next slide then, please, Georgia. So quickly about the training, the ladies earlier said perfectly about the training. We do very similar down here in South Wales. So our training program is around 12 weeks, but if it takes you longer, then it takes you longer. There is no rush. Nobody's pushing you to get on with it and get home. You take as long as you need, as long as you're safe and comfortable doing everything. A lot of questions I get asked is, I'm afraid of the needles moving, especially doing nocturnal. So I thought I'd pop in a picture here of how we tape down here in South Wales anyway. You can see everything is taped very securely. I am a rock and a roller in my sleep. I flip and turn each way all the time, and I've had no problems whatsoever. It doesn't move a single millimeter. So that really doesn't need to be a worry. A lot of people also ask about, can I do this by myself? I live alone. Surely I can't do this by myself. As the lady said earlier, you absolutely can. I do. I live alone with my dog. So everything's taken into account with that. As I say, the training goes on for as long as you're comfortable. So if it takes you longer because you really want to make sure you've got it because you're alone, then that's what it takes. It's not a problem at all. Down here in South Wales, we have 24/7 technical support. So anything wrong with the machine, if you've got error messages or things that come up on the machine, you've got somebody on call 24/7 to fix that. Unfortunately, we don't have the amazing facility of the 24/7 medical team that they have up in North Wales. Hopefully that's going to come in soon. But the training covers everything to make sure you're safe and you know what you're doing if you have any medical sort of side problems, especially nocturnal. If it's the middle of the night and you're not sure what's happening, your training will kick in and you'll be 100% safe. As the girls down here say, clamp, clamp, and come off. If you have any query about what's going on, if you're not sure, if you're panicking, they always tell you just come off the machine. Everything can be fixed later. So that's great. I wanted to put this in here quickly. There's a lot of support for home dialysis on Facebook support groups. I know Kidney Wales has a superb community group. If you're not a member of that, I encourage you to all join. There's lots of support on there, but there's also other support pages of people in the UK doing home dialysis, and they're a great resource to ask questions and get support. Just checking what I was meant to say. So pros and cons. We all know if you're on dialysis already in unit, then you know traveling to and from the hospital, especially if you rely on hospital transport, is absolute nightmare. We all know that. If you drive yourself, you know parking is a nightmare. Biggest pro for me starting home dialysis was not having to travel into the hospital 3 times a week, not finding parking spaces, not relying on ambulance transport. It's really great. By doing nocturnal myself, I've got my days back. Unbelievably now, I don't know what to do with my days. I've got so much time that I never had before. You know, before I was in 3 days a week, and the day after dialysis, you feel rubbish because it's so fast and hard on your body. It takes you the day to recover, and then you're back into dialysis the next day. We know that feeling. Doing nocturnal, I've got my days back, and I've actually bored. So I'm trying to find things to do. Georgia knows I'm volunteering for everything under the sun with Kidney Wales. So that's great. Home dialysis obviously brings in a lot more flexibility. You decide when you're going to dialyse. Your prescription will be given to you. You know, you need to do, I do 4 nights of 10 hours. I didn't get on with 5 nights of 8 hours. So the team adjusted it for me, and I do 4 nights of 10 hours. But I can start that at any time if I want. If I want to go out for a meal with friends and family in the evening, and it means I don't get on dialysis until 11 o'clock at night, it's not a problem. I just on for longer in the morning the next morning. And so that flexibility is amazing. You've also got more control. You've got autonomy over your treatment, and I think that's really important for all of us. We've got some control. A lot of this journey is taken out of our hands, and having that control back is really worthwhile if you can do it. Now the cons. We have to talk about the cons as well as the pros. It's stressful. There's no doubt about it. Home hemodialysis is stressful to begin with. The teams are amazing and the support is there, and as ready as you feel, you're ready. That first time you have to do it by yourself with no backup. It's stressful. But as I say, the training's there, the team is there for support, and you can do it. Ordering stock and storing, as you saw on the previous slide, there's a lot of storage. There's a lot of managing stock. You know, you have to order your stock every 3 weeks, 4 weeks for your delivery to come in. So that's a con, I suppose. Again, the space it takes up. I'm very lucky that I've got a spare room that I managed to convert to do this in. That was really important for me because I wanted, on non-dialysis days, I wanted a non-medical area. I wanted to go to bed and not see anything. I know some people like it in their bedrooms. and it's in their familiar environment, that's great. For me, I had to have a break. I had to be able to shut the door and forget about it. And something that a lot of people don't think about is, especially if you've been dialyzing in unit for a little while, coming home can actually be quite isolating. You're used to going in and seeing the same crowd 3 times a week, speaking to the nurses, speaking to your friends that you make on dialysis, having a catch up. You're at home by yourself doing this, so it can be quite isolating. Our team down here are great, and they ring me every 2 weeks just to have a check-in. I can also ring them any time of the day. I often pop in if I'm passing Morriston just to say hello and get a bit of feedback and have questions. So the team is there, but it can be a little bit isolating. As I say, emergency procedures, potential machine issues. As I say, we have technical support down here 24/7. Because I'm alone, dialyzing alone, they've put in a care line for me at no cost. So that's an emergency line where I can press a button and get through and speak to somebody, and they'll contact emergency services for me. So if I'm really not feeling very well, I can dial 999 myself or something. Then I've literally got a button by my bedside that I press and somebody will help me out. Again, key safe by the front door so emergency services can access. All that is provided by the hospital. So if anybody's got any questions, I'm happy to answer any questions. For your information, I've also done PD in the past as well, at the beginning of my journey back in 2008. So I've got a bit of knowledge about CAPD. But any questions on home dialysis, I'm more than happy to help and answer them.
That's great. Thank you so much, James. If anybody does have any questions, please just raise your hand and then I can give you control in order to speak. James, I will say you did mention some Facebook support groups, and I know you mentioned our own, but was there any others in your local area that was worth mentioning?
There's a great Chronic Kidney Disease UK Facebook group. That's for everybody suffering with CKD, but there are a lot of home dialysis patients on there who've really helped me actually when I've had questions. You know, things that you wouldn't want to ask the team, but maybe a fellow patient can give you their perspective. So they're really, really useful.
I can see that we've got a question coming through. There we go, Karen, if you would like to ask away.
Hi, thank you. Hi, James. That was very interesting. So thank you for telling us about it. I'm not yet on dialysis, although I'm having the talk with the team at the moment about what I prefer, etc. Originally, I thought about peritoneal dialysis, but I'm really confused. Until I seen the slide tonight, I have no idea about the water. And they said about you've got adjustments made to your water supply in there.
Yep.
I have no idea about any of that. So thanks for enlightening me. It's just like very early in my journey, and I know it's coming, but it's still very frightening to me. I live with my husband who isn't well himself. So basically I'm disabled a year now. So I just think it's another addition of something that I've got to learn to live with. And I just wanted to ask, is when you before you had your first lot of dialysis, with your actual feelings, your health, did you feel like desperately tired all the time and, not able to do things before you went on the dialysis?
So the first time I went on dialysis, I was very young.
Yes.
So I was 22.
Yeah.
I get my maths right. So I didn't actually have many symptoms at all.
I
think being that young, I compensated
Right, yeah.
well. So it wasn't until I was down to about 3% function that I got any symptoms really, which was just overwhelming tiredness.
Yes, yeah.
So yeah, that's the main part really. Yeah, for the water, you can see in the photo on screen now. It's quite a setup for water. Obviously, for that as well, you need to do fortnightly filter changes. So those 3 pods there that you can see,
Yes, yeah.
they need changing every fortnight. There's a machine which I don't think's in any of the pictures there that needs maintenance as well once a week. So there's quite a lot involved in it all, but all the training goes through that.
Oh, good.
They do it over and over and over again.
Until you know it off by heart. Then.
Exactly. Especially for nocturnal, because the last thing you want to do is for the machine to wake you up in the middle of the night with a problem, and then you're half asleep still.
Yes.
Don't know what you're doing. So the training really is very comprehensive. So you can do it half asleep.
Yes.
So my neighbour has actually quite a few times said to me, "Oh, your machine went off a couple of times last night." And I went, "Oh, did it?"
Yes.
Because I had no idea.
Yeah. And you said you lived with a dog.
Yes.
You've got a dog, and I've got a dog as well, Boo. But when I was speaking to my kidney nurse, she said you've got to be very careful when you have a dog when you've got dialysis. Is that right?
Absolutely, yes.
Dog is banned from your room that you set up in, I presume, so.
Yes.
Yeah, that's what I intend to do, because I'm going to convert one of the bedrooms. So.
Yes, it's just better because what they find is dogs and cats like moving things, don't they?
Yes.
Things that move, and the pipes move.
Yes.
When they just move in the night, and the last thing you want is for your dog or your cat to start chewing through your pipe in the middle of the night.
Yeah.
That becomes a big mess.
Thank you, James. Thanks for that. Much appreciated.
Thank you so much for asking the question, Karen, and I hope that James managed to cover any of your concerns there. That's great. Thank you so much. Did anybody else have any questions that they would like to ask James, who obviously, as he said, has also done some PD as well? Even if it's just a patient perspective, obviously we can give you as much facts as possible, but actually going through it can be different. And as James mentioned, it can be stressful. And we want to make sure that you're feeling supported across the board there. So anyone else have any questions before we move on? Okay, no, I can't see any. So what we'll do is we'll just move up now, and I'm just going to quickly summarize. So we've had James's perspective today on, as a patient, what it's like, how it feels, the training, how supported he felt. We've also heard from Kareen about our financial support. So again, Kidney Wales offer financial assistance grants, carers vouchers. We also do food and wellbeing vouchers. All the links to these, to the information on the grants and any frequently asked questions, they are all in our PDF, which can be found on the Kidney Wales website. So if after today, I appreciate it's a lot of information to take in. If you go away thinking, okay, what else was mentioned and you've forgotten some bits, it should be all in that PDF document then that you can download and have access to whenever. The ladies at the start talked about the different types of home dialysis. So during the day, nocturnal and PD as well. So I think they give quite an extensive talk then about the different types of home dialysis you can have. And again, they echoed that there was lots of training and support available. Now, we have sort of covered that the training and support in North and South Wales is slightly different, and they are trying to work to get them all equal. But hopefully that covered any questions you had about the differences. We've also heard lots of questions about dialysing alone at home, and as you've heard from everybody today, whilst it can be quite daunting at first, there is lots done to accommodate you and make you feel safe both through the training element and also, like James mentioned, that call button that you have at home. And space and accommodation, again, another question that came up, and we hear that there is a little bit of differences between North and South Wales. If you are in North Wales, there is a little bit more that can be done. But letters from your doctors to support you, and your renal team to support you in your housing scenario, can be very beneficial. So I just want to say a massive thank you for all of you who joined us today, and listened in. If anybody does have any last minute questions, feel free to ask. However, if you would rather just drop us an email, you could do so at team@kidneywales.cymru, and I'm sure Corinne will be able to pick up then any questions you may have through there. So thank you all for joining us, and enjoy the rest of your evening, everybody.
Thank you, everyone.
Thank you so much.
Bye.
Cheers. Bye.